Hi, now I will talk about a rational use of personal protective equipments or the PPE. Now, what all are components of PPE? The first is face shield and goggles. Now, contamination of the eyes, nose, and mouth is likely in a scenario of droplet generated by cough, sneeze of an infected person or during aerosol generating care procedures carried out in a clinical setting. Inadvertently touching the eyes, nose, and mouth with a contaminated hand is another likely scenario. Hence, production of the mucous membranes of the eyes, nose, and mouth by using face shields, goggles is an integral part of standard and contact precautions. The flexible frame of goggles should provide good seal with the skin of the face and covering the eyes and surrounding areas and even accommodating for prescription glasses. Now, masks. Respiratory viruses that include coronavirus target mainly the upper and the lower respiratory tracts. Hence, protecting the airway from the particulate matter generated by droplets, aerosols prevents human infection. Contamination of mucous membranes of the mouth and nose by infective droplets or through a contaminated hand also allows the virus to enter the host. Hence, the droplet precaution, airborne precautions using masks are crucial while dealing with a suspect or confirmed case of COVID 19, performing aerosol generated procedures. Now, the masks are of different types, like the triple layer mask and the N95 respiratory mask. The mask to be used related to particular risk profile of the category of personnel and his or her work. Now, coming to the triple layer medical mask. A triple layer medical mask is a disposable mask, fluid resistant, providing protection to the wearer from droplets of infectious material emitted from coughing, sneezing, and talking. An N95 respirator mask is a respiratory protective device with high filtration efficiency to airborne particles. To provide the requisite air seal to the wearer, such masks are designed to achieve a very close facial fit. Such masks should have high fluid resistance, good breathability, clear identify internal and external faces, duckbill cup-shaped structure design that does not collapse against the mouth. If correctly worn, the filtration capacity of these masks exceeds those of triple layer medical masks, since these provide a much tighter air seal than triple layer medical masks. They are designed to protect the wearer from inhaling airborne particles. Gloves. When a person touches an object per surface contaminated by COVID 19 infected person and then touches his own eyes, nose, or mouth, he may get exposed to the virus. Although this is not to be a predominant mode of transmission, care should be exercised while handling object surfaces potentially contaminated by suspect confirmed cases of COVID 19. Nitrile gloves are preferred over latex gloves because they resist chemicals including certain disinfectants such as chlorine. There is a high rate of allergies to latex and contact allergic dermatitis among health workers. However, if nitrile gloves are not available, latex gloves can be used. Non-powdered gloves are preferred to powdered gloves. Coveralls. Gowns, coveralls are designed to protect the torso of healthcare workers provided from exposure to viruses. Although coveralls typically give 360-degree protection because they are designed to cover the whole body, including back and lower legs, and sometimes head and feet as well. The design of medical isolation gowns do not provide continuous whole body protection. That is, possible openings in the back, coverage to the mid calf only. By using appropriate protective clothing, it is possible to create a barrier to eliminate or reduce contact and droplet exposure, both known to transmit COVID 19, thus protecting healthcare workers working in close proximity within 1 meter of suspect confirmed COVID 19 cases or their secretions. Coveralls and gowns are deemed equally acceptable as there is a lack of comparative evidence to show whether one is more effective than the other in reducing transmission to health workers. Gowns are considerably easier to put on and for removal. An apron can also be worn over the gown for the entire time the health worker is in the treatment area. Coverall gowns have stringent standards that extend from preventing exposure to biologically contaminated solid particles to protecting from chemical hazards. Shoe covers. Shoe covers should be made up of impermeable fabric to be used over shoes to facilitate personal protection and decontamination. Head covers. Coveralls usually cover the head. These using gowns should use a head cover that covers the head and neck while providing clinical care for patients. Hair and hair extensions should fit inside the head cover. This is because it has been found that coronavirus can stay inside your hair also for long periods of time. Now, coming to the specifications, now going through this briefly, you should know that a person who is at the health desk, immigration counter, temperature recording station is at a low risk. So, for him, a triple layer medical mask and glove is more than sufficient. But for a person at the holding area, isolation facility, at the health office, sanitary staff, or administrative staff, these have moderate risk. So for them, N95 mask and gloves are required. For those who are attending severely ill COVID-19 positive cases, they are a high risk, and a full PPE, as I described before, from head coverall to gloves to goggles to gown to shoe covers is required. So that is the rational use of PPE at the point of entry. Now, coming to the hospital setting, an OPD or a respiratory clinic or a separate screening area. Now, at the triage area, where we will be triaging patients, we provide triple layer mask to the patient because it's a moderate risk place. And to the doctors or the sisters or the paramedical staff, we give N95 mask and gloves. Patient also gets a mask, as I said, it's a triple layer mask. Now, at the screening area, the registration counter in the hospital setting, it's a moderate risk. So, give the doctors or the staff, medical staff, N95 mask and gloves. And at the temperature recording station, holding area, doctor's chamber, sanitary staff, all are moderate risk, and same N95 mask and gloves have to be given. For visitors accompanying young children and elderlies, it's a low risk and triple layer medical mask has to be given. All hospitals should identify a separate triage and holding area for patients with influenza-like illness. If there is no triage area, holding area for patients due to resource constraints, such hospitals will follow the above guidance for general OPD. Now, coming to IPD or inpatient services, individual isolation rooms, cohorted isolation rooms, activities like clinical management are for moderate risk, and N95 gloves and masks are required. For ICU, it's a high risk and a full PPE will be required. Similarly, in IPD, sanitation is a moderate risk, whereas ICU can be a high risk place where the full complement is required. Whereas where dead body is transported to mortuary, it's a lower risk and triple layer masks and gloves is more than sufficient. Now, coming to emergency department. Emergency department can be divided into attending emergency cases, and that is a moderate risk, and N95 mask and gloves have to be provided. However, if he is attending to severely ill patients of SARS or any severe respiratory illness, that is SARI, a high risk and a full complement of personal protective equipment is required. Now, coming to pre-hospital services, that is the ambulance services. Now, the ambulance transfer to designated hospital is a setting of moderate risk if transported patients are not on any assisted ventilation. So, N95 mask and gloves are required. For a severely acute respiratory illness patient while transporting is a high risk and full complement of personal protective equipment is required. For the driver who is driving the ambulance and is away from the posterior part of the vehicle, it's a low risk and triple layer medical mask and gloves are required. Now, coming to other supportive and ancillary services like the laboratory, where sample collection and transportation is occurring or sample testing is occurring, is a high risk place and full complement of personal protective equipment is required. For mortuary, where dead body handling is occurring, is a moderate risk place and N95 mask and gloves is required. While for performing autopsy on that patient of COVID-19 positive patient, it's a high risk and full complement of personal protective equipment is required. Coming to sanitation, cleaning frequently touch surfaces, floor, cleaning linen in COVID treatment patients areas is a moderate risk and N95 mask and gloves are required. For laundry and CSSD, it's a moderate risk and N95 mask and gloves are required. For other supportive services like administrative, financial, engineering, security, etc., no risk is there and no PPE or no possibility of exposure to COVID-19 patients. They should not venture into COVID-19 treatment areas. Now, health workers in community setting like Ashas, Anganwadis and other health staff, field surveillance, low risk, triple layer mask, gloves is required. For doctor at supervisory level conducting field investigation, field surveillance, clinical examination, it's a medium risk and N95 mask and gloves is required. Now coming to the quarantine facility, remember that persons being quarantined are low risk, so they need a triple layer mask. Whereas healthcare staff, quarantine means a person who has been in contact with a COVID-19 patient but has not been tested positive. Now, healthcare staff working at quarantine facility are again, if they are just monitoring and temperature recording, they are at low risk and a triple layer mask and glove is sufficient. But if they have a clinical examination of symptomatic person, then it is a moderate risk situation and N95 mask and glove is required. For support staff, which is a low risk, a triple layer mask and glove is sufficient. For home quarantine, where person is getting quarantined at his own home, which is an isolated area away from his family members, and is able to contact his nearby hospital easily by telephone or through some person, then the person can be home quarantined. So the person being quarantined at home does not generally have any symptoms and is a low risk person, and a triple layer mask is sufficient. A designated family member who is taking care of the person being quarantined is also considered low risk, and for him gloves are more than sufficient while cleaning commonly touched surfaces or handling soil linen. For other family members, there is no risk and no PPE is required, and they just have to maintain a social distance of 1 meter from the person under home quarantine. Senior citizens in the household should stay away from such persons under home quarantine. We should remember that coronavirus has been more affecting more males and also people who are more than 60 years of age. So we should remember that these people are said to be protected. Now, points to remember while using PPE. PPEs are not alternative to basic preventive public health measures such as hand hygiene, like washing your hands regularly, respiratory etiquettes, like coughing inside the inner part of your elbow, which must be followed at all times. Always, if possible, maintain a distance of at least 1 meter from contact suspects confirmed COVID-19 cases. Always follow the laid down protocol for disposing of PPEs as detailed in the infection control department and control guideline. Okay, that completes our entire course on coronaviruses, where we have started from what is coronaviruses, how it is transmitted, how we can prevent it, is there any treatment for it, is antibiotic helpful, are there any vaccines available for it, what are the do's and don'ts, what are the myths behind it, and what are the personal protective equipments available, and which personal equipment has to be used. I hope by the end of this course you have a much broader knowledge than what you started with regarding coronavirus. And as far as a layman or a public health personnel is concerned, this is more than sufficient for protecting yourself. Thank you.